A change for Marion County 911 dispatchers. They now offer callers a mental health option.
This comes after an influx in those types of calls and the city's effort to provide clinician-led mental health treatment. WRTV's Rachael Wilkerson is live in studio tonight.
And Rachael, how does this change impact mental health care in Indianapolis?
Well, that option allows dispatchers to ask questions related to the mental health crises. Then the dispatcher will decide whether to send medics, IMPD's mobile crisis assistance team, or the city's clinician-led response team. The Metropolitan Emergency Services Agency says this is an effort for better communication among first responders and community members.
911, is this a police, fire, mental health, or EMS emergency?
Mental health is a top priority for dispatchers answering the 911 calls for help.
I think it gives the caller a sense of safety because they had the choice to choose a mental help option instead of the police. Sometimes when they say police, they get nervous, they think it's going to end bad, but when you say mental health, they choose that option.
Dispatcher Emerald Eddy says the option better sets first responders and patients up for success.
This is my goal, is to still help people. Because it's a hard job to do because most people, they can't handle the stress of it.
Metropolitan Emergency Services Agency Chief Tom Sellis says being able to filter out mental health calls specifically helps alleviate some of that stress. He says dispatchers began answering the lines this way when the city's clinician-led response team began.
It has helped a lot. So because we're able to prompt people, now they understand that service is available, and they might have not thought initially. They would always think, well, I need the police for this. It kind of also prompts the other first responders is that this is a mental health run. We need to respond to it differently, whether it's police, fire, EMS. It's not the same as the other runs could be.
Clinician Eric Arnold says not only does it free up police, clinicians are able to connect with patients on a personal level.
Not only can we provide resources and the help they need, but we can also serve as examples to the community that recovery is possible.
Arnold says there is a rise in calls.
Yeah, we're definitely seeing an uptick. I think we've had 350 calls as of May.
But is hoping that will continue as more people learn about the option.
And once the community learns more that they can ask for us, they can simply request CLCR. It's going to open up more opportunities for us to help the community in general as a whole. Take away some of the stigma, hopefully, so people aren't as ashamed to call and say, hey, I need help, and breaks down those barriers.
Marion County dispatchers also encourage you to call the non-emergency number when possible. That number is right here. It's 317-327-3811. Mark.
Rachael, thank you. And if you are having mental health crises or thoughts of suicide, you can get immediate assistance by dialing or texting this number, 988. That's the Suicide and Mental Health Crisis Lifeline.